Okay, where do I begin? Hi everyone, I'm Alan, and I'm an end stage renal dialysis patient. There, I said it. Yes, I'm an end stage renal dialysis patient. What does that mean, you might ask? Well, I have kidney failure. So I'm suffering from kidney failure, and the way modern medicine treats kidney failure is you go on renal dialysis until, in my case, you can get a kidney transplant. So right now, I'm on kidney dialysis, hemodialysis to be exact. Previously, I was on peritoneal dialysis. Um, but before we go through all of that, where does my journey begin? My journey began with chronic kidney disease, um, which was diagnosed in, I want to say, early 2024. I would say around March of 2024, I was diagnosed with chronic kidney disease, stage 3, um, in which my PCP, my primary care physician, recommended that I see a nephrologist. So I started seeing a nephrologist um, that same year, and my nephrologist started to monitor me and monitor my kidney functions, monitor my blood pressure, monitor my sugar, my glucose, and they noticed a couple things. They noticed that my kidneys weren't working too well, to say the least, which was my PCP's primary thought. And then they noticed that my blood pressure was very elevated, and also my glucose was, because I'm diabetic as well, was elevated. And so they recommended medication for getting my blood pressure down, medication for getting my glucose down. But unfortunately, that didn't work. Um, I was then told to get a kidney biopsy, which we were trying to determine the cause of my kidney disease and my kidney failure, which turns out to be diabetic neuropathy, which is basically diabetes and high blood pressure, hypertension, destroyed my kidney. At the time, I was bigger. I was overweight, to say the least, and I was, you know, still being monitored. This during the summer of 2024, I was still being monitored somewhat for my kidney functions, but I started to get a little weaker, um, a little bit more tired, not wanting to do as much. Um, so I had an appointment with my nephrologist in September of 2024, based on me going to do more current lab work. The current lab work saw my kidney functions had decreased markedly, enough where my nephrologist at that point initiated um, dialysis treatment. So he referred me for dialysis treatment. At that point, I needed to get a what is called a CVC catheter. So I had a CVC catheter installed. Um, and then I started dialysis I had that the catheter installed on a Monday, and I started dialysis because they didn't have a chair for me at the dialysis center in South Queens in New York, where I live, um, until Thursday. So they basically called me and told me that my dialysis days would be Tuesdays, Thursdays, and Saturdays. So I was going to I was doing in-center treatment for dialysis, um, hemodialysis on Tuesdays, Thursdays, and Saturdays. Fast forward, um, my nephrologist at the time did not want me to I'm in treatment right now, so that's what you're hearing. If you hear some beeps, that's me in treatment right now. So my nephrologist at the time did not want me to stay in center. He actually wanted me to do what was called peritoneal dialysis. Peritoneal dialysis is basically dialysis where a catheter is installed in my abdomen, and my abdomen would then be filled with dialysate, which is fluid, and the fluid is supposed to help clean my blood. Um, I had the catheter installed in November of 2024, November 1st to be exact, of 2024. I remember the exact date, and I started peritoneal dialysis training, which is like a 2-week training for um, at my new center, my new dialysis center, which was Queens Home Therapy, on November 18th that month. Um, Initially, when I started peritoneal dialysis, it was going smoothly. There were no hiccups. Um, Lab work showed in the initial stages that my blood was being cleaned effectively. So it was good. Peritoneal dialysis does come with a lot of supplies, a lot of work that you have to do in terms of getting supplies on a monthly basis. After about 2 months on peritoneal dialysis, my lab work started to deteriorate somewhat in terms of clearance levels. My blood was no longer being cleaned effectively by the peritoneal dialysis, so my nephrologist, who I had to switch nephrologists because I was at a new dialysis center. My new nephrologist at this time, he started to increase my peritoneal dialysis dosage. So I would have to be longer rather than being on the machine overnight for 8 hours. On peritoneal dialysis, you do while you sleep for 8 hours. I would have to be on peritoneal dialysis for 10, and the doses start for 10 hours rather than the 8 hours. I started doing that around, I want to say around March of 2025. After after about a month on the increased dosage on the peritoneal dialysis, took more labs. Lab work still showed that there was no success with the increased dosage in my clearance levels for the peritoneal dialysis. At which point, I had to take matters into my own hands. At that point, I got what is called a fistula. I went for a fistula surgery. I was like, no, I need to switch. I needed to go and switch to hemodialysis. And at hemodialysis, you need, rather than having a CVC catheter, CVC catheters are meant to be temporary, because CVC catheters actually is a direct link to your heart. So, and you can't get a CVC catheter wet. So I went to have a fistula installed. So I had fistula surgery in mid to late March, and then Fistula takes about 6 to 8 weeks to mature. At which point, over the course of March, April, my fistula was maturing. I let my nephrologist know I had a CVC catheter installed. I want to switch to home hemodialysis. Um, at which point, my my Queens Home Therapy Center was informed that I'll be switching to home hemodialysis, and they were waiting on the recommendations of the surgeon for my fistula on when they would clear me for the use of fistula access, because my fistula was maturing. Fast forward to May of 2025, my fistula matured, at which point home hemodialysis training was initiated in late May, May 19th to be exact, in which I was required to go to the center 4 days a week, for home hemodialysis training, at which point I was trained on this little machine right here. It's called the Next Stage Cycler, Hemodialysis Cycler. The Next Stage Home Hemodialysis Cycler, basically, cleans my blood, and I'm able to do hemodialysis at home. So between May 19th to July 25th, 2025, I was in home hemodialysis training. Home hemodialysis training is not an easy training. You basically, oh, there goes my phone. Gotta pause and come back to you. Okay, where did we leave off? We left off, I believe, talking about hemodialysis training, home hemodialysis training. So currently, I just completed home hemodialysis training, and I am now doing hemodialysis at home, using the Next Stage cycler. I spent, quite a few months doing hemodialysis training, just making sure that my fistula was, properly matured, making sure that I knew how to operate the functions of the machine, making sure I knew how to set up, making sure I knew how to cannulate myself, making sure I knew how to clean the machine, all of those things. So the past few months was very, very interesting, to say the least. I never thought I would actually be able to cannulate. Remember my cannulate? Stick a needle in my arm. Actually stick a 15 gauge needle into my arm. Actually, two of them. My arterial needle and my venous needle into my fistula access port. So it's yeah, it's been an interesting couple of months, learning to do all of that. But this is where I'm at now, while I wait for a transplant, a kidney transplant, or kidney donor. Apparently, it takes a while for a kidney donor unless you have a living donor who's willing to donate a kidney right away. So that a living donor will be more immediate than a deceased donor. And given my age, my transplant center, which is the NYU Transplant Center, would prefer me to have a living kidney donor. So how did I transition? So, question that people I'd ask, because some people who knew that I was on different forms of dialysis previously. So I initially started out on hemodialysis. Remember I mentioned earlier with a CVC catheter in September of 2024. And then I transitioned in November to peritoneal dialysis, which was dialysis in my abdomen, where the fluid dialysate would fill my abdomen, and dwell And it'll be a few exchanges of that over a 12-hour period, 10 to 12-hour period, um, for peritoneal dialysis. During labs, I mentioned that it was not effective. My nephrologist noticed that I was not getting good clearance, which means my blood was not being properly cleaned, and which I took upon myself to say, Alan, in my head, it's time for you to get a fistula. And I pushed my nephrologist and I got a fistula. I said I need to get a fistula installed. So I got a fistula installed in March, went for the surgery. And it took a while, took about 6 to 8 weeks for the fistula to mature. And then that's when I started home hemodialysis training in May of this year, when my fistula matured. At that point, I would say, because I was still on peritoneal dialysis while my fistula matured, my health significantly declined because my clearance levels of my blood was barely minimum, barely negligible in terms of cleaning my blood on the peritoneal dialysis. So the when I got onto hemodialysis, when I got to the clinic for the very first day of home hemodialysis training, they noticed right away that I was severely weak. I was dehydrated. I was weak. Um, I crashed, I would say, in the chair. I was, passing out in the chair. The nurses noticed that, so the nurses were shaking me, waking me up, because they noticed how weak I was, and because I was not getting good um, cleaning from the peritoneal dialysis. Para in other words, some people might say it's scary, but I would say I almost had one foot in the grave, because of my blood was very toxic at that point and needed to be cleaned um, properly. So when I started hemodialysis training and I did my first session of hemodialysis, it was a very short session, because my blood pressure was dropping good, and that was another thing. My blood pressure was really, really low in the beginning stages of my hemodialysis training. So it was really, really low, because I didn't have any fluids in me. I was very weak, dehydrated, and coupled with the fact that I had lost over 80 pounds, um, contributed to my low blood pressure and everything. And my blood being toxic, not being cleaned properly was another factor of me, passing out during my very first hemodialysis training session. It got better as I went for more sessions of hemodialysis training, as I learned how to do how to operate the next stage machine. My hemodialysis became much, much better. I got a new life in me, as my tech would say. I got my color back because I was very, very pale. She said, you looked very pale in the beginning, but now I got my color back, because hemodialysis is much more effective. I met my clearance goals easily, above and beyond, for hemodialysis clearance. They wanted my clearance level to be a 2.0. At this point, my clearance level on hemodialysis was 2.6. So I passed my clearance levels, for the goal of, the hemodialysis actually cleaning my blood. It was actually much, much better. So yeah, that is where I'm at now. I just graduated from hemodialysis training on July 25th. So it took a few months. So now I'm officially home. And this is my hemodialysis room at home. So here I have my hemodialysis supplies. I have spare supplies back here in these cabinets. They're all labeled in these drawers. I have my hemodialysis supplies. Like, for example, this drawer right here is my saline drawer. These are where my saline bags are kept. I have micropore tape. I have gauze. I have band-aids, prep pads, alcohol prep pads. I have needles, syringes, syringes without needles. I have more. I have some boxes back here. I don't know if you can see that, but these boxes are some what we call express bags, which is part of the hemodialysis process, where I currently know how to make my own dialysate from tap water using the pure flow system on my machine. But in case that's not working, and in case I don't want to use um, the pure flow and make a bag using the pure flow, they have what we call express bags, which in my case is my one treatment takes about 50 liters of dialysate, which is about 10 express bags. 10 express bags. So if I want to do treatment for 1 week, I would need 20 of these boxes for 1 week's treatment of dialysis. Because I do dialysis 4 days a week for 3 hours now. So it takes 50 liters for one treatment for me, which is 10 bags, which is 10 bags or 5 of these boxes. There's two bags in each box. So it'll be 5 boxes, 10 bags of express bags. If I'm not using the express bags, I would be using the pack. I would make a pack, which is using the pure flow system. So I would make a batch of a 50-liter bag of dialysate using my tap water in my house, which is, there's a pure flow system, there's a whole filtration system that my machine runs through. And I'm going to show you that in a clip in a minute or two. So I'm going to show you my entire machine system, the setup. I'm not doing dialysis today. Before I was cut off by my phone ringing, I was actually in the process. I was doing dialysis, but I said will refilm the second half of this video when I'm not doing dialysis, which would make it easier for me to show you the machine and the components of my machine that I do dialysis on, which is the Next Stage system. Next Stage is a sub-company of my dialysis center, which is Fresenius Kidney Center, Fresenius Kidney Care. I'm a home dialysis patient, so my home center is Queens Home Therapy, which is in Fresh Meadows, Queens. So I'm going to go through a couple things. I'm going to show you as I turn the camera around my setup at home and how I do dialysis at home. Okay? So stay tuned.